and it is a great pleasure for me to have a talk or a virtual platform. And few days back, Madam Rama Madam, she called me and she invited me for giving a talk. And I took an opportunity. One small correction, I'm retired now. Last year, I retired from my university job, but still I'm working as a visiting faculty with the same university, with the same department. So it is a indeed pleasure for me to have all distinguished listeners, distinguished people attending this virtual meeting. Rama Madam, Ashok Sir, Jaishree Madam, and all other respected faculty members. So I'm very much thankful to all of you for inviting me. As Madam suggested, that today's my topic is biocrystals in human health and in vitro studies with medicinal plants. On the left-hand side is a building of our university, right-hand side where I worked for nearly 40 years. Now, biomaterial crystals, the two opposite things are shown over here. There are two opposite things. For industrial purpose, we require large crystals, good quality, and perfection. And for biomaterials, the opposite things are required. We don't want that crystals to be grown in our body, and we want them, if at all they are grown, they should be in a very small size. So the two opposite things are there. For industry purpose, we require large size, perfections, and large quantities. In our human body, we don't want them to be grown in our body. So that should be no growth of crystals, ideally speaking. And if at all they are growing, it must be very small in size. Now, occurrence of biocrystals, there are three broad areas. One, they are occurring in human, then plants and animals. The crystal growth of specific biomaterial compounds occur in body or living organisms. There are many reasons, and various pathogenesis and theories are proposed. So biocrystals encompass various crystals responsible for different ailments, human suffering, and health-related problems. Now, biomineralization is a very important process taking place in biocrystallization. And the factors which are influencing, they are categorized over here. And the environment is very important. Then biological, biochemical, and physiochemical. And then again, controlled mineralization and induced mineralization. So these factors are very important. In other category, the inorganic physicochemical process, and where the geological minerals are being deposited in human beings. So these are the broad categories where the biomineralization is taking place. Now, main factors, they are influencing the biocrystals. So main focus of the study of biocrystals, the first is how we study the biocrystals. So the one important part is the growth phenomenon of biocrystals. So how they are growing in body, and to study the growth of crystals in human being, it's a very important thing. Another important thing is the parameters affecting the growth of biocrystals. So various parameters are affecting on this growth, and it is very important to study, because by studying these parameters, we can control their growth. Then morphology of biocrystals, morphology or shape is very important thing. Suppose the crystals are spiky, then when they move in a vessel, they scratch and the bleeding is taking place. But if they are smooth, then no bleeding or comparatively less harm is taking place. Then in vitro studies are very important. We are focusing on that in vitro studies because we are trying to mimic the atmosphere occurring in a human body. Then mechanism of growth and dissolution. Again, it is an area of our interest. First, we have to study the mechanism of growth of biocrystals, and then we have to focus that how they are dissolved. So these two things are very important, and growth inhibition and dissolution of biocrystals. So growth is taking place, and we have to see the conditions, under which condition that dissolution is taking place. So dissolution of crystals under various conditions is very important to study. Characterization of biocrystals. Whenever we have any biocrystal growing in our body, whenever it is removed, the characterization is very important. And there are several characterization techniques available, like powder X-ray diffraction technique, then Fourier transform, infrared spectroscopic study, then various other spectroscopic study, then thermogravimetry, and various type of analysis available to characterize the biocrystals. The types of biocrystals in a living body. The biocrystals, they have three broad categories. One is organic, another is inorganic, and mixture of the both, organic and inorganic both. Then biocrystals of spatial interest. So we are going to focus only on three different type of biocrystals in today's talk, because today's talk is quite elementary one. And it covers the basic things regarding the biocrystals occurring and how to dissolve them or how to inhibit their growth. So we are going to focus on that. And in my next talk, I will go into the much more technical details and our results. So today is some sort of an introductory talk. So we are going to focus only on the three main aspects of biocrystals. One is urolithiasis, then atheropathies and gallstones and atheromatous plaques. Why to carry out studies on biocrystals? So these elements can be dealt with considering three main aspects. One is the prevention, then relief and cure. All three things can be dealt by our study. And one is growth is of crystals. That relief is something like if the growth is reduced or inhibited, then the relief is done. And cure, then once the crystals are grown by some mechanism, they are dissolved completely, then cure is taking place. So all the three different aspects can be dealt with the present study. Now we are coming to different type of biomaterial crystals. So biomaterial crystals are very beautiful. They look very beautiful, but they are painful and they are not very comfortable for the patients. So biomaterials or biomineral crystals induce several diseases in human body, even in animals also. And protein and crystals are grown. And this is the photograph of a protein crystal. So protein crystal and virus crystals can be grown. Then urinary stone problem. We have shown the cartoon. In a top cartoon picture, the healthy kidney, so the face is laughing, and the kidney with a lot of crystals and lot of stone. So kidney is in a sad phase. So urinary stone occurs in a body, which is very painful. And urinary stones are crystalline depositions. Then occurrence of urinary crystals in world. So 12% population of European Union is expected to be suffering from kidney stone problem. And 15% population of North India are again expected to be suffering from urinary stone problem. And there are stone belts, particularly in our region, Saurashtra. There are many places where people are suffering from urinary stone problems. So they are known as stone belts. These are the chemical constituents of different type of crystals, which are composed of the calcium oxalate monohydrate, the calcium oxalate dihydrate, calcium hydrogen phosphate dihydrate, tricalcium phosphate, magnesium, ammonium, phosphate hexahydrate. So these are the crystals, colite and struvite, and we have grown most of these crystals in our laboratory. So these crystals we have grown in our laboratory. These are some humor expected or associated with kidney stone problem. So in one cartoon with a chisel and hammer, the doctor is trying to remove the kidney stone from a patient. And in other cartoon, the kidney stone itself is giving its experience to small kidney stones. I'm sorry, kids, but last night your father passed him out. Father is not passed away, but passed him out. And another thing is in a Marathi, the person feels that the stone is something like a stone required for kapchi, for paving the road, but it is not that. It is something like a stone from the urinary tract. So Nasik stone and urological center, the common place in this cartoon. So these oxalate crystals are one of the main crystals occurring in urinary stone. And they are also known as a mulberry stone, covered with sharp projectiles or projections. And they mask, whenever they pass, they bleed things, and they are very hard and they are radio opaque. So these are the photograph of the calcium oxalate stone, as well as how they look in a urine, that is shown in the next slide. The phosphate stones are usually called as a calcium phosphate, and calcium, magnesium, ammonium phosphate or triple phosphate. And sometimes they look like a dirty white, and they are also radio opaque. And calcium phosphate is also known as a bruchite, and they also appear like a needle under microscope. So the photograph is shown that they look like a needle in a microscope. Then another type of phosphate stones are the struvite stones, and they look like a staghorn. Staghorn is something like a deer. Their horns and the struvite stones, they look almost same. So that is why they are known as a staghorn shape struvite stones. So these are looking very completely tracked. Because of their branches, they scratch and the bleeding is taking place. Crystals are mainly responsible for urinary stone problem. There are three broad categories: the calcium oxalate, calcium hydrogen phosphate dihydrate, ammonium magnesium phosphate, and all of these crystals are grown in laboratory using the gel growth method. So we are going to discuss later on about this gel growth method. Another issue for that crystals are very valuable, that is arthritis. It is due to the deposition of small crystals in softer tissues of joints. The crystals induce inflammation, particularly when they break. So arthritis is also because of the deposition of crystals. This is some, here some humor associated with arthritis. Cartoons are shown, particularly with the old people, and particularly the athletes have a knee joint problem. And sometimes they are advised to put chocolates, so lubrication is done very efficiently. The occurrence of arthropathies or arthritis. In India, prevalence of rheumatoid arthritis is 0.75%. In China and Indonesia, it is 0.4%. And arthritis affects 0.3 to 1% of population all over the world. And in world, in October 12th is celebrated as an Arthritis Day, World Arthritis. Now, crystals mainly responsible for arthritis problem. There are three main: sodium urate monohydrate. And all these crystals are responsible for the problems related to arthritis. First is gout. Gout is due to the deposition of monosodium urate monohydrate crystals in joints. Gout is also known as king of disease and disease of kings. And gout is mainly due to the highly nutritious food full of proteins. So in one of the journals of arthritis, the editor made a comment, it is this of kings and kings of disease. Why it is a disease of kings? Because in European countries in old time, people, the kings, they used to eat a lot of red meat and highly nutritious food. And because of the purine metabolism, the deposition of uric acid used to take place, and which used to induce gout. And why it is known as a disease of king of disease? Because it is so much painful, and that is why it is known as a king of disease. So it is a famous quoting that king of diseases and disease of kings. Now, pseudo gout is due to the hydroxyapatite, and the picture shows that we have grown hydroxyapatite small crystals in form of a ring, and these rings are known as a Lissagang rings, and the crystals are grown in the test tube in a gel medium. So popularly, the formula is CF5PO4 3OH, and the predominant mineral component of vertebrate bone and tooth enamel. So this is a very important biomineral. It is responsible for our bone strength. And whenever we smile, the tooth enamel is displayed, and white teeth is due to the component hydroxyapatite. It is the most stable and most compatible calcium phosphate form. And it is so stable that after the cremation, the asthiful is made up of hydroxyapatite. Pseudo-gout, formation of calcium pyrophosphate dihydrate, CPPD, crystals in soft tissues such as cartilage, meniscus, synovial tissue leads to the CPPD deposition disease. The appearance of these crystals in the synovial fluid can give rise to acute arthritic attack with pain and inflammation of joints, a condition called as a pseudo-gout. So the picture shows the cartoon related to the pseudo-gout, and one test tube, we can see that small crystals are being grown in the test tube. These are CPPD crystals. Now, atherosclerosis, when plaque or fatty deposition is taking place, it is called atherosclerosis. These deposits are made up of cholesterol, fatty substances, cellular waste product, and calcium and fibrin. So that is responsible for the atherosclerosis. Another biocrystallization is taking place in form of a cataract. Ferritin crystals in cataract. The calcium oxalate crystals are rarely found in lenses of eyes, and the unique structure of ferritin forms a spherical shell in which the iron is stored as Fe3 in a crystalline mineral. So the crystalline structure or the molecular structure is shown, and the crystals are responsible for cataract problem also. So the reference by D.G. Brooks, they have studied the ferritin crystals role in cataract. Then gold bundle stones, these are hard stones and may develop if liver makes more cholesterol, and then the bile can dissolve it. So these are the particularly the gold bundle stones or gold stones. The cholesterol, cholesterol is termed as a Jekyll and Hyde molecule, and we have a famous novel, Mr. Jekyll and Mr. Hyde. Usually two different faces are there. One is a very gentleman-like face, another is a Satan-like face. So the cholesterol is termed as a Jekyll and Hyde molecule. So it is useful as well as harmful also. A small amount of cholesterol is used by adrenal glands to form adrenocortical hormones by the ovaries to form progesterone, estrogen. And cholesterol and lipid substances control the rate of evaporation from the skin. So cholesterol is having a good effect, and they are also playing a role in a sex hormone. And it is mentioned in the literature that cholesterol is not present, the dehydration would take place very rapidly. So it controls the evaporation rate from our skin. And there are term as a good cholesterol and bad cholesterol. LDL that delivers cholesterol to our cells, and HDL brings it back from the cell. And that is why the LDL, low density lipoprotein and high density lipoprotein, they perform this work. And that is why they are termed as a good cholesterol or bad cholesterol. The human suffering in 2001, 17 million people died due to cardiovascular disease globally. In 1986, bypass surgery was 10% of the heart-related surgery in India. And today it's around 60%. And gallstone disease affects 12% people in USA. And this is just the introductory part. What is cholesterol? We all know about the cholesterol. Cholesterol is one of the most abundant and best known steroids in animal kingdom. It was first found in 1770 as a component of gallstone, and French lipid chemist Chauvel identified it in an animal fat in 1815. And the name is because of the cholesterol is from sterol, steroid alcohol, and that is originating the word cholesterol. The crystals are also found in plants. So I have taken an example. This plant is, it's a very popular, our indoor, and leaves are having small crystals and well-shaped crystals. The morphology is well-defined, and they grow within the leaf. Now, in vitro study, now we are focusing on gel growth, and these crystals are grown in laboratory by mimicking the atmosphere of human body by gel growth method. Now, here we have shown an example. The test tube is taken where the gel is set. So gel is having a gel structure. It's a porous structure, and it is a hydrogel. So the water is within the porous structure. And you are pouring a supernatant solution on the top of a gel. So first you have to mix a weak acid with sodium metasilicate, and that makes a silicate polymer, and that polymer is having a cross chain like a structure, and that forms a gel. It's a porous one. And in that structure, if you are putting a supernatant solution on a set gel, then that solution slowly diffuses into the gel, and the reaction is taking within the gel material, because gel is one reactant is already there in the gel, and another reactant is being diffused from the top. And whenever these two reactants, they react it with each other, the small nucleus takes place, and then deposition of nutrients takes place on that nucleus, and the crystal grows. The crystal growth is taking place in a gel medium. So the photograph shows a test tube where crystals are grown in a gel. They are not put in a gel, they are growing in a gel. Inhibition and dissolution study. Here the aim is to control or stop the growth of crystals which create human suffering. And ideally, crystals should be dissolved. So here we have to study the dissolution or inhibition of growth. Ideally, the crystals must be dissolved. But if it is not possible, then their growth is to be inhibited. And a very good book is written, that Advance in Crystal Growth and Inhibition Technologies by Z. Amjad, and that is a very popular book, and it's available in a market. technique is a growth inhibition and dissolution study. This technique is developed by one of my student, Dr. Bharat Parekh. Right now, he is in a Pandit Deen Dayal Energy University in Gandhinagar. And this technique is very simple technique. It is using a petri dish and two slides and cover slip. Usually in any pathological lab or any biological lab, these things are available. First thing is that you take a petri dish and you try to put a small drop of the gel solution.